we can separate them into band and bypass, and each of the operations have different complications. Some of them are the same for every surgery. But as far as the gastric bypass surgery, what are some of the complications we're looking at?
Well, globally, you know, when we're doing these operations, because obesity is a lifelong incurable illness, and the therapy you have to live with for life, we have to look at the complications of the operation, not just within the first 30 days or the first 60 days, but for lifelong. And I think that's one of the things that when we publish our data is kind of unusual, because our complication rates go up with every publication, not because we're getting worse at what we do,
right,
but because it's a cumulative reporting of all of the lifelong complications that can happen. And we have to factor that in as well. And that's why these other studies are so important. So for the gastric bypass, obviously we're looking at things like ulceration, nutritional things, are people getting enough protein, vitamins, minerals. And we look at these very closely, and in fact we do a lot more tests on our patients than the average patient would get. Don't you find that you pick up unusual things that not related to the surgery, but just because you're following patients so closely now?
Yeah, I definitely have to agree with that. You know, if we look at the nutrition of our patients before surgery, it's surprising how many of our patients are actually malnourished and have low vitamin levels before surgery. And so we treat our patients with vitamins and so forth after surgery, whether it's a restrictive surgery or a malabsorptive surgery or a combination surgery. You know, specific to the gastric bypass, you know, if we just looked at our complications for 30 days post-op, like some studies do, or 1 year post-op, like some studies do, we're going to miss some of the long-term things that we like to help keep our patients aware of and also away from. And so, you know, if you look at things like internal hernia or stenosis, those are some of the things we talk about. Well, stenosis is probably our #1 complication, but is it truly a complication? Because that's a factor of how tight do we make the opening at the bottom of the pouch. And if that was you know, 0, where 0 people had that too tight, then we're probably making it too big. They can eat too easy. They're probably not going to lose as much weight or gain some back over time. If we make it too small, then we're going to have to stretch that too many times. So we're actually happy with the 5 out of 100 that need to have that stretch.
Well, certainly, we have to think of the long term. So whatever we do, whatever intervention, whatever operation we do, we feel better if it's reversible, if it's fixable, whatever happens, we can go in and take care of the problem. And that's probably the case for most of the operations that don't remove tissue, such as a sleeve gastrectomy, the biliopancreatic diversion, operations such as this.
Well, each operation definitely has its own specific risk factors and complication problems. And so the band has its own set of complications, and they're all very rare. The gastric bypass has its own set of complications. One of the things that's commonly thrown out there is the nutritional aspect, which is better. And I mentioned about the vitamins because everybody's malnourished to start with, essentially. But there are different types of bypasses. We hear a long limb bypass or a distal bypass. The one that we do is the proximal gastric bypass. Why is there such a difference?
Well, I think this is a confusing point for most patients. They think a bypass is a bypass, but it really depends on how long you make those limbs. And what I think patients should understand is that there is a difference and there is no standards. So you really have to research your surgeon, their operation, talk to their patients and find out more about it. Because again, when you get a bypass, they're not always the same. Well, Dr. Boone, you know, you've talked a lot about the different operations, but what I think most patients would really want to know is what their life is going to be like after surgery. How are they going to eat, that sort of thing.
Well, you know, both of the band and the bypass operation limit how much you eat a little bit by volume, and so they'll be eating a little bit less, but they're going to eat a lot better, more healthy. But how's their life going to change? Hopefully in a number of ways. As they lose weight, it'll be easier to get around, less aches and pains on the joints. They'll be breathing better, their heart works better. Usually all those medical problems go away that we already talked about. So in general, the patients should feel tremendously better about themselves, and it's just a whole new lifestyle.
Our results sort of say that. The medical problems generally go away most of the time.
Yeah. Our results, you know, everybody wants to look at how many pounds and how many numbers and so forth, but the most exciting thing from my side of the practice is to see all those medical problems go away and see the patients get so much more healthy.
Exactly.
And the pounds are also very nice to look at the same time because they go in correlation. You know, part of it is the changes with weight leading to helping with the heart, but also some of the things that we talk about as far as the metabolic syndrome.
Yeah, it's pretty exciting to see someone's medical list go from here to nothing in a period of a year.
And the medication list.
Pretty satisfying as a doctor.
It's by far the most rewarding thing I've ever done in medicine. You know, both you and I started working with our hands in different types of jobs. That's probably why we went into surgery, so we can still work with our hands. But also, I think a big part of it for me was I wanted to see the cure. And with surgery, you can cure somebody's gallbladder problem, you can cure somebody's appendix problem, and so forth. But what we see with the metabolic and bariatric surgery, the cures and the help that we're giving patients has just been so rewarding for me.
Yeah, I think one of the quotes from my patients who said, "I'm now free." And I didn't really understand that at first because I thought that we were creating restriction in their lives. But it turned out that the constant hunger, the wanting to look for food, the next meal, was such an onerous thing. To free that up a little bit and to give them a better life where they can move and exercise and play with their kids is especially satisfying.
One of the things I hear, and I don't ever get tired of hearing it, is thank you for giving me my life back. And I'll never get tired of hearing that from a patient.